Thank you, Vivian. So I think we would all embrace the fact that mental health, brain health, and heart health are each leading independent societal priorities. But it might not be apparent to you that the integration of all of these together, interwoven deeply, already happening before adulthood. And despite the fact that these things are independently major societal priorities, we do not currently integrate heart and brain health. And this is an unfortunate missed opportunity, because one of the best things we can do for youth to protect and preserve their brain health is to increase and improve their heart health. Currently, there is a divide, there is an isolation between the body and the brain as it relates to the healthcare system. And this is unfortunate because there's missed opportunities. Let's take, for example, Cindy. So Cindy is a 16-year-old with depression as a consequence of having bipolar disorder. Her friends and her family are worried. She's lost interest in things. She's experiencing a lot of sadness. She doesn't play sports anymore. And to add insult to injury, she feels ashamed of all of this and is reluctant to come forward for treatment. Cindy obviously needs treatment. Hopefully, she'll get an assessment that will lead her to medications or therapy or the combination that will benefit her depression. But unfortunately, these days, it's unlikely that her heart health will be integrated into her care. This is especially unfortunate for Cindy because the extent to which bipolar disorder and other psychiatric illnesses increases the risk for heart disease among people is greater in women than in men. So the overall goal of my presentation today is that at the end of it, you'll have an appreciation of why heart health is important to youth with bipolar disorder and what heart health can offer them in terms of benefiting their circumstances. So the association between heart disease and bipolar disorder is not new. It's been noticed for over 100 years. And what we know is that individuals with bipolar disorder have both increased rates of heart disease, but also premature onset at least 10 years earlier than the general population. So this raises the question of what is it that explains why such a common illness is especially common in bipolar disorder? And there's a number of factors. So the first is traditional cardiovascular risk factors, such as elevated cholesterol or blood pressure. And in addition to that, we know that the medicines that are used to treat bipolar disorder can sometimes aggravate those traditional cardiovascular risk factors. In addition, individuals with bipolar disorder are known to lead less optimal lifestyles, healthy lifestyles. So they have more addictions, more use of alcohol and smoking, but less optimal nutrition and less exercise. However, even when you bring all of these things together, the rates of heart disease in people with bipolar disorder is over and above what we would expect. So this raises the question of what else is going on. And that's where the focus of my career has been for the past 15 years, is to try to understand what is it about bipolar disorder that is driving this increased risk. Because if it's not just those other explanations, it suggests the conclusion that bipolar disorder itself is a risk factor for heart disease. We've focused on mechanisms, and particularly we've emphasized a topic called microvessels. So I'll take the analogy of roadways. If you think of a highway, that would be a large blood vessel, transporting large volumes of body across large distances in the body. But then you have what's called microvessels or tiny vessels, and those would be more like side streets or driveways that ultimately deliver the oxygen and the nutrients in the blood to where it's going to be used. So working together with colleagues in neurology who have expertise in dementia and stroke in the elderly, we've used MRI measures of cerebral blood flow, or blood flow to the brain, as an index of brain health. And what we've learned about youth with bipolar disorder is that their brain's demand for energy is greater than healthy adolescents. And in turn, they require higher levels of blood flow in order to maintain normal brain functioning. We've also seen that among youth with bipolar disorder, when they have lower blood flow in their brain, they have more severe depression symptoms. Moving a little bit beyond the brain, we can look at the eye. So we can all appreciate that it's said that the eye is the window to the soul, and I think that that's true. But it's also true that the eye is a window to the brain. And what do I mean by that? The retina, which is the main nerve at the back of the eye, is actually a direct extension of the brain. And so its health is a proxy for brain health. In turn, the microvessels that feed the retina are also direct analogs, very similar to brain blood vessels. And unlike the brain, which exists in our skull, the eye can be photographed and it can be imaged using computerized devices, and this gives us a direct view of what the brain might look like. So working together with colleagues in ophthalmology, we use these eye imaging technologies and found that measures of blood vessels in the eye of youth with bipolar disorder corresponded with their brain. So those youth that had wider blood vessels in their eye had higher rates of blood flow in their brain. And why is this important? It's important because MRI is not accessible to everyone. It's very expensive. It has important value. It's a core part of our research. But eye imaging is something that's scalable. It's widely available, it's easy to use, and it's very quick. And so we think that if our goal is to really increase recognition of heart-brain connections in relation to mental health in youth, this is going to be an important technique moving forward. Let's go one step farther from the eye into the heart. So we've worked together with colleagues in cardiology using MRI techniques. The first technique that we looked at was to examine the heart's structure and function. So in clinical terms, this is looking at the different chambers of the heart and how big they are, or looking at the efficiency of the heart muscle as it pumps. And what we found was that youth with bipolar disorder were no different than healthy youth with regard to those traditional clinical metrics from the MRI. But when we dug deeper and looked at microvessel function, that's where we found a difference. What we did was used a test that had been pioneered by colleagues at McGill Cardiology, and it involves asking youth to do a 30-second breath hold task. And this is known to evoke a vasodilation response. The blood requirements of the heart increase as you hold your breath. Oxygen needs to come in. And so the blood vessels dilate as you hold your breath, and that feeds the heart muscle. And that signal can be quantified. And what we found was that despite the fact that the clinical measures that are used in the MRI were the same, these microvessels were not functioning the same in youth with bipolar disorder. They were slower to respond to the breath hold task, and they responded less robustly. And so that discrepancy between the traditional clinical metrics and this novel vascular metric tell us that this is one of the ways in which we can personalize the preventive heart care for youth with bipolar disorder. What can we do about all of this? So a number of things. First of all, we can increase the use of heart health screening. Currently in psychiatry, the general reason that we do heart health screening in young people is to assess for side effects of medications. And it's obviously important to do that. But we've heard already that the risk of heart disease is greater independent of medications and of cardiovascular risk factors. So we really need to be screening all youth with bipolar disorder. Then in terms of integrating treatments, it's important for that to happen. Currently, if you look at heart health guidelines, so the threshold at which you screen, the threshold at which you intervene, those are all based on the idea that you want to prevent future heart disease in a youth who's right now without heart disease. However, heart health is important not just to heart outcomes, it's important to brain outcomes, and it's important to mental health outcomes. In addition, psychiatric treatment guidelines are almost completely silent about heart health, which is quite remarkable. So integrating is another thing we could do. A third thing we can do is focus on women's health. As I mentioned earlier regarding Cindy, the extent to which psychiatric disorders such as bipolar disorder increase the risk of heart disease is greater in women. And it's important to recognize that that affects young women as well. So for example, we've found in our studies, you heard about exercise earlier, that teenage girls with bipolar disorder have lower aerobic fitness as compared to males. And you can say, okay, that may or may not be a big deal. However, it is part of the explanation for why girls with bipolar disorder have more severe depression symptoms than boys, because those two things correspond. And that's something that's actionable. And finally, I think that one of the things that we can do that's most near term is to reconceptualize bipolar disorder and to reconceptualize mental illness in general. So we've come a long way from when we used to think of mental illness as a personal failing, as a character deficit, and to understand that it's a brain disease. And I'm really grateful that neuroscience and imaging and things like this have created in society a broader recognition that this is not just a personality issue, this is a real brain disease. But I think that we can take it a step further, because there's still a substantial amount of stigma towards mental illness, and recognize that in addition to being a brain disease, bipolar disorder is also a physical disease, a body disease of the heart. And bridging this false divide is very important, because not only does integrating heart health, as I mentioned earlier, benefit outcomes such as the brain and the mind, but it also reduces the shame and the stigma, the self-stigma and stigma in families and stigma among practitioners that delays the time from when someone has the onset of their illness until when it's treated. This division is not working well. So in conclusion, the next steps that we're going to do is expand this focus. I've been focusing primarily on bipolar disorder in young people, and we are currently launching a study together with colleagues at McGill that will look at 3 forms of serious mental illness. One is major depression, the second is psychosis, and the third is bipolar disorder. And we're going to be doing a large 2-site study with colleagues at the Douglas Mental Health Center here in Montreal and the McGill University Health Center, and examine heart-brain connections among these youth with these serious mental illnesses. Where is this road leading us? Think of all the benefits that can come from bringing these 2 parallel lines, mental health and physical health, brain health and heart health, together. Let's circle back to Cindy. Let's say she goes and she gets treatment. Maybe she gets medications, maybe she gets therapy. How much better would it be if we could screen her for her heart health early? Make sure that that's monitored over time. We know she's at risk for early heart disease, and we should be on top of it early. We can also integrate new forms of treatment that are not common in psychiatric practice. So connect her with a nutritionist to make sure that her nutrition is ideal. And how about exercise? We've heard earlier about exercise, and it's really important to personalize exercise. There's so many barriers, over and above the barriers that affect the rest of society, to exercise among people with serious mental illness, motivation, medications, fatigue, etc. So we could pair her with an exercise coach to give her a personalized exercise intervention and help her stick with it and derive its benefits. I think that eliminating the false divisions between mental health and body health or physical health are of fundamental importance. And in particular, to hasten the time from when someone has the onset of the illness until when they're treated. So in the interests of the youth of today and the adults of tomorrow, I think it's important for these changes and this integration to start now. Thank you.